Hello, this morning we will be presenting SARS coronavirus and the SARS-like novel coronavirus. SARS coronavirus causes severe acute respiratory syndrome. It is in the family Coronaviridae and is an envelope virus with a large, positive, single-stranded RNA genome. SARS coronavirus infects a wide range of birds and mammals worldwide. The first reported case of SARS coronavirus in humans was in China in 2002. A doctor treated patients exhibiting symptoms of SARS. After treating them, he flew out of the country and stayed in a hotel. In the hotel, the virus was thought to spread between guests who left by plane to other countries, spreading the virus globally. The virus is transmitted through the entry of respiratory droplets from an infected person onto the mucosal membranes of a susceptible person. The virus is also transmitted through touching objects contaminated with infectious respiratory droplets and then touching mucosa. The pathogenesis of SARS begins with flu-like symptoms. Other symptoms include fever, muscle pain, headaches, and shivering. The incubation period is 2 to 7 days. After this time, more severe symptoms can develop, such as a dry cough, shortness of breath, and sometimes diarrhea, though the exact mechanism of this is unknown. SARS is mainly a viral pneumonia, so respiratory symptoms can rapidly progress. Lung pathology examinations showed that SARS infection resulted in widespread alveolar damage. Some diagnostic tests that are used to identify SARS include chest radiographs, blood cultures, and sputum gram staining. PCR and immunological tests can also confirm infection. There is no vaccine for SARS. Antivirals and other drugs may be given to reduce symptoms of the disease, as well as supplemental oxygen and ventilators. The best prevention is early identification and isolation by quarantine. Standard infection control methods like hand washing and use of personal protective equipment are also effective measures. So there are a variety of characteristics of SARS-CoV that have contributed to its emergence in humans. Bats are thought to be the primary natural reservoirs of the virus and infect small carnivores such as civets. These animals are sold in wet markets, which are common to the East Asian region. Bats are natural reservoirs for many viruses due to the animal's ability to live long enough for transmission to occur. Furthermore, bats are often not affected by the virus. SARS-CoV also has the potential to undergo recombination of its spike glycoprotein. This may have contributed to its emergence because it provides genetic variation. Different coronaviruses can also undergo recombination with each other. For example, SARS-CoV is thought to be the product of recombination between an avian coronavirus and a human coronavirus or a mouse hepatinovirus. SARS-CoV also infects the respiratory tract and is more common in late winter or early spring due to the air temperature and humidity. During the outbreak, SARS-CoV was spread primarily by healthcare workers, in addition to anyone the infected patients had come into contact with. This may have contributed to the spread of the virus, as viral shedding only occurs at the onset of symptoms, which is when patients would seek medical help. The spread of SARS-CoV was also facilitated by travelers visiting the region, which allowed the virus to spread outside the region. After the SARS outbreak ended, another novel coronavirus wasn't discovered until 2012, when a patient in Jordan was reported to have SARS-like symptoms. The first reported case was in Saudi Arabia, and the patient was admitted into the hospital for SARS-like symptoms and later died. A second patient had traveled to Saudi Arabia and was found to have the same virus. These patients were infected with a SARS-like novel coronavirus that was similar to SARS-CoV in genome and structure. The animal reservoir is thought to be bats as well. Contraction of the virus for some of the patients was thought to be the result of a farm visit. Unlike SARS-CoV, the route of infection from human to human was not from healthcare workers, but rather from family members of the ill. For one patient, some of the people he came into contact with became sick, but none were positive for novel coronavirus. This suggested that the human-to-human transmission was different than SARS-CoV. There does not appear to be any evidence of spread by long-distance air travel, and the virus appeared to be localized to the Middle East. The SARS outbreak ended in 2003 of July, months after the WHO had declared a global outbreak. At the end of the outbreak, there were more than 700 deaths worldwide. Some important takeaways are that SARS-CoV causes severe acute respiratory syndrome and is thought to originate from bats. Air travel was responsible for the massive global spread of the virus. Transmission of the virus occurs through respiratory droplets between an infected individual and non-infected persons. SARS progresses from a shortness of breath to a dry cough to atypical viral pneumonia and possibly death if treatment does not combat the virus. Almost a decade after the outbreak had ended, the emergence of a SARS-like novel CoV was found primarily in the Middle East. Unlike SARS-CoV, it appeared to be limited to that region and has not spread globally. In the case that it does spread, the world could be looking at another outbreak like SARS-CoV.